Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence with innovative procedures and expertise for the most advanced eye care.
Hello and welcome to this edition of Access to Democracy. I'm Steve Francisco, your host today. Today's a special day at Eagan Television as we say farewell to the executive director of Eagan TV, Mike McEntee, who has served Eagan Television as our executive director for the past 4 years. He's done an extraordinary job during that time and is moving on to a new career opportunity. We here at Access to Democracy want to thank him for all of his work and support that he has given to our program and to Eagan TV, making ETV one of the most successful community public television programs in Minnesota. It's my pleasure to welcome our guest today, Minnesota State Representative Ruth Richardson. And Ruth, this is your first time appearing on Access to Democracy, is that correct?
It is. Thank you for having me.
We're pleased to have you here today. So as it is your first time, if you could tell our viewers just briefly, tell us a little bit about yourself, where you grew up and where you went to school.
Sure. So I grew up in St. Paul in the Frogtown area, went to St. Paul Central for high school, so have deep roots within Minnesota. My family actually moved here to Minnesota right before I was born from Mississippi, so I grew up there.
And I understand you grew up in a rather large family. Tell us about that.
Yeah, a little bit of an understatement. 7 brothers and sisters, 4 brothers and 3 sisters, and even with all that my parents had to do with that, my parents also opened up our home to foster kids throughout our childhood as well, and so there was always a house full of kids when we were growing up.
And I understand that 3 of your siblings have disabilities as well.
Yes, growing up with 3 siblings with disabilities, I learned a lot about the various struggles in terms of access to health care, access to affordable medications, and it's one of the things that really sparked the interest in health equity for me.
And sparked your interest, I assume, in running for a seat in the Minnesota legislature, which you won in 2018.
You know, Steve, I think of myself in some ways as an accidental politician. There was no big strategic plan that started as a child, like leading up to this. But
you mean when you were 10 years old, you didn't say, I'm going to be in the Minnesota legislature someday?
That never came up. My decision to run for the State House of Representatives was really based upon what I was looking around and seeing within the community, and knowing that there was an opportunity to really make a difference and move the needle on so many of the challenges that we're seeing within our community around affordable health care, access to medications, and just ensuring that everyone in the state has an equitable opportunity to thrive.
Good. We're going to talk about some of those in more detail in just a few minutes. I understand you grew up in a working class family.
I did.
Your dad worked for Metro Transit, and something happened to him while he was working there too, which had a big effect on you and your family.
Yeah, so when I was growing up, my dad was a bus driver for Metro Transit. I spent a lot of time on the 16A riding up and down.
That's downtown Minneapolis to downtown St.
Yes.
Paul, before light rail.
Before light
Right.
rail. Funny story about light rail. My parents, we lived 1 block off of University. When I was a child, they got a letter that they were thinking about building a train that would potentially affect our home. And it was really interesting that 30 years later that train came true, but we thought it might come a little bit sooner than that. But with my dad with Metro Transit, there was a day that he was injured while he was on the job, and he had to be rushed from work for emergency surgery. He was hospitalized for a number of weeks, and when he came home, he had a long road ahead of him in terms of recovery. And within that space, it really hit home for us that had he not been in a union and had he not had the support of his union brothers and sisters and the support that comes with being in a union, we likely would have lost everything.
And I assume, Ruth, you're talking about union benefits, including union health care.
Correct.
I can relate to this story because my own father was a machinist union member, a longtime mechanic at the old Northwest Airlines.
Sure.
And he had an on-the-job injury, and thankfully for his health insurance through the union, as you point out, we had the same experience. Yeah, supported him through his hospitalization and his recovery.
Exactly, and it's one of the reasons why I stand with unions today, because I know the impact that it really has for families.
Very good. So tell us about your House District 52B, and tell us what it is now and what it's going to be because of reapportionment, that it's still going to be called 52B, but the geographical boundaries of your district, if you will, they're changing rather significantly, aren't they?
Yeah, it is rather a significant change. So I currently have 52B, and that includes all of Inver Grove Heights, Sunfish Lake, a small sliver of Egan, including the Vikings training facility, and also and also part of Mendota Heights. And so with redistricting, the district is still 52B, but I'm only holding on to 2 precincts that I currently represent. So it's an entirely new district.
Basically a new district.
Yes, a new district. So more of Mendota Heights than I currently represent, more of Egan, and a little town called Mendota.
Very good. So what committees have you served on in the Minnesota House?
So I'm currently chair of the Education Policy Committee, and then I serve on the Education Finance Committee, the Commerce Committee, and the Transportation Finance and Policy Committee. And I am also, I was appointed as a member of the Missing Murdered Black Women and Girls Task Force. So that's those are my committee assignments.
I'm glad you brought that one up. We're going to talk about that a little bit later here too. Let's go back to the healthcare issue. You've had a long-term interest in the issue of fetal alcohol syndrome. What did that spring from, and what type of work have you done related to fetal alcohol syndrome?
Yeah, so my interest in fetal alcohol spectrum disorders really goes back to childhood. And, with my parents opening up their home to foster kids, we had a number of kids that came through our home who had been impacted by prenatal alcohol exposure. Prenatal alcohol exposure can cause permanent brain injuries. And so with that disability, you can see, kids having some challenges with education, challenges as adults like finding employment and being able to maintain employment if people don't really understand the disability. So my interest in that was really sparked as a child, and also in seeing families trying to navigate systems and sometimes hitting up against barriers. So as an adult, when I had the opportunity to work at the Minnesota Organization on Fetal Alcohol Syndrome, I jumped at that chance because that personal experience really drove that passion.
And we should say the types of impacts you were describing earlier, Ruth, those are impacts that affect the quality of life for these people who have them for their entire life. I mean, really beginning from when they're young, as you said, difficulties perhaps going to school and learning, through their later teenage years and adolescence into adulthood and even into older age.
Yeah, I mean, you can see short and long-term memory issues. You can see individuals that really struggle to read social cues. And what we oftentimes were seeing were kids that were really vulnerable to being taken advantage of as well. And so it really does go to the quality of their life and the opportunity. And also knowing that having fetal alcohol spectrum disorders, you can still have a successful life. You can still be someone who achieves things. It's just ensuring that the appropriate supports are in place from a healthcare perspective, and also assuring that there are supports to help accommodate the disability, be that in school or within employment.
Crucial to helping people overcome some of the adverse effects of these issues. In previously endorsing you, I noticed the Star Tribune said, quote, "You have learned a great deal about the intersection of health and public policy." What have you learned about that intersection of health and public policy as a legislator and in your prior experience working on healthcare issues?
You know, my very first foray into policy was when I was a first-year law student at William Mitchell College of Law, and I talked a young legal aid attorney into taking a chance on me. And with that, I was part of a decriminalization of homelessness task force. And with that work, I had the opportunity to talk to a number of veterans, a number that had served in Vietnam, that came home and found themselves at some point to be homeless, dealing with health issues, post-traumatic stress disorder, and learned about the ways that our systems were criminalizing people for just not having a place to stay. And what really jumped out at me, because we were working to try to get the state's vagrancy statute repealed, because that statute basically said if you're over the age of 18 with no means of supporting yourself, you could be arrested as a vagrant at any time. So just sort of for existing, you could find yourself arrested for that. And we went to the legislature because we gathered all these stories. We came in with veterans, and we were thinking, we have the compelling moral story here to really make a difference. And we weren't able to get that vagrancy statute repealed the first time. And so we went back as a group, and we thought about it, and we're like, what was missing? Why were we not compelling? Because we had these compelling stories, and we thought about it. It's the data. Let's start tracking how many arrests are happening across the state of Minnesota for what we called livability offenses, sleeping outside, vagrancy, and let's put a dollar amount on what it's costing our courts, what it's costing our law enforcement, to really get an understanding of what that price tag was for the city.
Not to mention the impact on individuals who are caught up in this cycle, if you will.
A lot of them were caught up in a cycle of serving life sentences in 10 and 15-day increments. So they would be arrested, serve time, get out on the street, and then they'd be arrested again. And so definite impacts, not only on their health, but from a physical perspective, but from a mental health perspective as well. So it's sort of trauma on trauma.
And you mentioned just a moment ago the impacts with the criminal justice system that people have because of these issues about perhaps being homeless, and also the intersection of homelessness and mental illness for many people. I assume you applaud the creation of the so-called drug courts, which have taken, I have a friend who's a retired Minnesota district court judge, And he actually served a stint in Hennepin County, significant number of years, as a judge on the drug court. He invited me to come join him one day, and it was absolutely fascinating because, you know, it was a real situation where the focus was not so much on punishment, but on trying to help people salvage their lives. And we're talking here, you know, about people who have had substance abuse issues. There's a similar thing that's happened with the creation of so-called veterans courts too. And those are two populations that are significantly and sadly among the homeless, especially veterans, people who have served this country in the military.
And they deserve better, right? And so, you know, the specialty courts are really important in terms of the ability that they have to divert individuals who are in need of treatment, and really understanding that at the root causes of substance use disorders it's a disease. And so, you know, thinking about our approach to that disease, and also understanding that it's not uncommon for substance use disorders to interact with mental health issues as well. And so for folks to have an opportunity to get some stability and to be able to address that disease, it's really important and critical.
If I were to ask you, Ruth, what is the biggest single unmet need of disabled Minnesotans today? I know that's a tough question.
Good question.
Would you have an answer for me? What would you say?
Well, I would say from my perspective, probably one of the biggest challenges that families face is navigating very complex systems. So growing up with 3 siblings with disabilities, at that time, and with the hindsight that I have now and with the experience that I've gained, I see so many missed opportunities, not only in terms of understanding what supports are out there and what's available, but also even understanding from a health equity perspective that I have a younger brother, for example, who lost his vision when he was 16 years old due to a very aggressive condition that he had. But as I learned more later, I learned there were ways that could have been slowed down. And so, so I think building systems that people understand.
And maybe more emphasis on simplification of access to services that already exist.
Breaking down the barriers, and also ensuring that it's not just a system that only you know, well-to-do individuals can focus on, but thinking about how do we build more bridges so individuals who might be underrepresented or face financial barriers can have doors opened up. And I know that there's been some work recently among many counties to create systems with no wrong door, you know, so that regardless,
so that they can get help.
Yes, exactly. And so I think more of that is really important.
Our time is starting to wind down, as it always does, but let me get to a couple of other issues while we have you here today. Mental health. By all estimates, we are going through a massive national mental health crisis. It disproportionately affects poor people. It disproportionately affects young people. I saw an estimate that nearly 20% of all American adults, that's roughly 50 million Americans, are facing mental illness. 15% of young people experienced a major depressive episode in the past year. What can and must be done to address this growing crisis in mental health care?
Well, one of the first things that we need to do is we really need to reduce the stigma around mental health, because the stigma, the secrets, they keep people sick. And so often there can be fear for people like opening up and sharing that they do in fact need help, because they're so concerned about the perception and the stigma piece. And so I think addressing that stigma is an important factor in that.
Yeah, because people are worried too about employability issues. Will I be able to get a job if I have to disclose that I sought treatment for mental illness? There's something called the new 988 hotline.
Yes.
What is that, Ruth?
Yeah, so this is a national network, and the hotline is focused on being able to have sort of a one-stop single telephone number that individuals can call in order to get help and in order to get support. And the hotline just recently launched, and so we are anxiously awaiting to see, what some of those outcomes are going to look like. But what I think is possible with this is ensuring that there's more even access for supports, and creating simplified ways for people to think about being able to, like, if I need help, where do I go?
Right. And we should say, I think it's fair to say that a lot of this mental illness and depression has stemmed from the pandemic we've been through, but that only exacerbated a problem that has been pre-existing for a long time, which has to do with issues of access to health care, equitable treatment for different groups of people, and accessibility to healthcare, basically.
Yeah, prior to the pandemic, we had a crisis from a mental health perspective, and we have a system that's never really been built out. It's not unheard of for people to wait days for a bed within, if they're having a psychiatric crisis. It's not unheard of for people to wait 6 months to get an assessment that might be needed for diagnosis. And so there's so much as a community that we really need to do to ensure that the supports are in place.
One of the big successes in the recent legislative session, I think most people would agree, was that the legislature approved and Governor Walz signed legislation providing frontline workers with bonus pay. My understanding was that it was up to $670 for frontline workers. We're talking about nurses, healthcare workers, first responders, people who didn't have the option during the pandemic to work at home. Some people could work at home, that's great. But these other people actually had to show up on the job. And I assume that you applaud that passage of that legislation and we're pleased with that outcome.
Yeah, definitely. We had hoped to secure more dollars to support those individuals who put themselves on the front lines and not only put their health at risk, but also put the health of their family members at risk. And when a lot of the world stopped, they kept going. And so that is definitely a win for this past legislative session. And I think it's also important to think about from the mental health side of things and the trauma side of things. There's been a lot of traumatic experiences that those frontline workers have faced. And so while this is a great first step, I think there's definitely more that needs to be done.
That can be done in the coming session and the years ahead. And it's going to require legislative leadership and leadership from the governor's office to get it done.
Yes, exactly. And this is a type of work that should be bipartisan. Everyone should support that.
Because it affects everyone.
It does.
Makes sense. I want to ask you about something you talked about earlier. I was very shocked to read this figure. You mentioned earlier missing and murdered black women and girls. You were on a task force dealing with this issue. And when I was doing some research on this, you were the chief author of the first bill of its kind signed into law. One of the figures that just stunned me, I didn't know this, 64,000 to 75,000 missing black women and girls in the United States. It was noted that women and girls of color are less likely to get Amber Alerts when they go missing, and that the homicide cases can take up to 4 times longer to resolve than with their white peers. Why is this so, and how is this new task force that you helped create going to help solve this problem and make things better?
Yeah, one of the important things about this task force is it's highlighted the fact that we don't even know how much of a crisis this is, because when you're thinking about 64,000 to 75,000 Black women
Shocking.
and girls
Right.
that are missing, it really talks about the need to really understand exactly what we're talking about, but also understanding that there are some nuances that we see in terms of the lack of media coverage. We see Black children make up about 30% of the missing children, but they get less than 15% of the media coverage. And you talked about the challenges with Amber Alerts. Amber Alerts are really critical because typically what happens within the first 48 hours is determinative as to whether a child will be found safely. And so when they're
Time is of the essence.
Yes, exactly. And what we are finding too often, there was just even a recent case, a young girl named Ellie Reagan up in Northfield, who has been missing now for over a month and known to be in danger, and there was no Amber Alert. And so these are the things that we're really thinking about. How do we create spaces so that families have equitable access to resources, to media, and to the answers that they deserve.
I want to mention real quickly, you were the author of legislation or sponsored legislation dealing with catalytic converters. We've seen a surge of thefts of catalytic converters off vehicles
Yes.
because of the valuable material that's in those devices. But when they're stolen off a vehicle, and we've seen this in suburban communities here like Eagan and Burnsville and Apple Valley in the South Metro, Mendota Heights, it's a very expensive repair for
Yes.
the vehicle owner, and you played a part in getting legislation passed this session that would address that. Tell us just really briefly about that.
Yeah, so the previous session, we were able to get legislation passed that created a pilot program to mark catalytic converters so that we could create some barriers to individuals being able to sell those marked catalytic converters. And this session, we were really trying to work to address the issue that we are seeing with some of the folks who are purchasing those catalytic converters, the scrap metal
Really
dealers.
stolen property.
Yes.
So you were prohibiting possession of detached catalytic converters with narrow exceptions.
Correct. And also making sure that, before someone would purchase a catalytic converter, that they're taking those steps to actually ensure that it's not stolen property.
Very good. I should mention, we're just down to our last minute, and I want to mention congratulations are in order. I understand you have been selected as one of 48 leaders across the country for a fellowship named the Henry Wolcott Toll, who founded the Council of State Governments, and you're going to be participating in that. So we're very proud of you for that accomplishment. Our time is running down. I want to thank you, Minnesota State Representative Ruth Richardson of District 52B here in the South Metro. Thank you for being our guest today on Access to Democracy, and come back and see us again soon.
You're welcome.
Always happens, Ruth.